Hey, what's happening? This is Jason, and today we're going to go through the phrase that destroyed the health of America. That phrase is, do you take insurance? In order to understand why this phrase is so pernicious, you must understand the basic principles of insurance. So insurance is a voluntary, we put voluntary in quotes because it was voluntary until the Affordable Care Act. It's a voluntary socialized financial instrument that allows a group of individuals to distribute each individual risk of a financially catastrophic event to the group. And you do this in trade for a low definite fee called a premium. So the group all contributes a premium in, and if there's an event to one of the individuals in the group, they get paid by the money that's paid into that pool. So most people kind of know this, but they don't know exactly why this is or how the insurance company figures this out. And so the insurance company does a lot of investigation. They got to figure out risk. Well, what's the risk of a big financial payout to a person versus what do they need to pay in terms of a premium? And they're so good at this that we just say, hey, if you want a safe investment, insurance is it. Go into insurance, and you should have a pretty safe place to park your money and do well. So this works well in the case of property like houses, housing insurance, or cars, car insurance, or even earnings, which is life insurance. Life insurance should really be called earnings insurance. But it doesn't work so well in the case of the human body, health insurance. Well, why is that? So where does health end? Where does reactive health end? You can see all the examples before this. They take care of something when an event happens. You get hit by a car, that's an event. That's something that happens to your body, but not when you do something proactive. So your car insurance doesn't pay for oil changes or alignments or tires. It doesn't pay for you to take your car to the mechanic. Yet these are proactive preventive measures that they do enhance safety and reduce the risk to the group of an event happening. But it's expected for some reason in health insurance that all care of the body due to chronic pain or chronic health conditions via the medications and chiropractic and physical therapy should be covered by health insurance. And so why is that? Why do we not pay for proactive measures in these types of insurance, but we do pay for it in health insurance? And the answer is just that proactive, preventative, and reactive care of the body is more ambiguous than it is for property. So there's a term in insurance, and that term is moral hazard. And the way moral hazard works is this. It happens when somebody changes their behavior related to having the insurance at all. So if somebody starts driving crazy after they get car insurance because they're like, if I get in a wreck, you know what? The group will pay for the repairs. Insurance will pay for the repairs. That's moral hazard. In the case of health insurance, if someone eats badly because they know insurance will pay for their diabetes medication, well, then that's also moral hazard. So the individual has basically offset their personal responsibility to take proactive measures in favor of giving it over financially to the group of insureds or the insurance company itself. Unfortunately, because the care of the body is ambiguous compared to houses and cars, insurance really kind of has a hard time differentiating what to cover, what's proactive versus what's reactive. What is the oil change or the alignment versus what's fixing a broken bumper? How do you apply that same measure to the human body? Insurance has a hard time figuring that out. So therefore, what happens is people subconsciously rely on insurance to take care of their body after they have a chronic disease, and they call it reactive when they should have been taking care of it and done that proactively. So that's why we have obesity, chronic pain, and diabetes epidemic. This is why premiums are so high, and we all pay for those people with chronic diseases and pain. It's also why people don't care for their bodies proactively, or because they're less incentivized to do so. And so then our whole population gets racked with what we call chronic deconditioned syndrome, which is where a group of chronic conditions, a person will get a group of these chronic conditions: heart disease, metabolic disease, and chronic pain, all at the same time. And so what's our takeaway from this? Well, reverse this mentality. Take proactive control over your own health and ownership over your own health, particularly related to those chronic health conditions and chronic pain conditions. That's just paramount. We can turn this ship around. Go ahead and start off by joining the Root Health Institute. That is linked below. It's free, so do it. Thanks.